Hi, we are a startup by the name of HygeiaAI that is into intelligent health analytics. The company was incorporated on September 2020. The founding team consists of Gautam and me. Gautam has 2 decades of experience in IT, banking, and healthcare across India, Far East, and the Middle East. He's an entrepreneur with expertise in product development, finance, and technology. Gautam is a BTech from AC Tech as well as an MBA from IIM Ahmedabad. Just like Gautam, I also have 2 decades of experience in IT, consulting, education, and healthcare in India, Middle East, and the Far East. I'm an expert. I'm an entrepreneur with expertise in product development, sales, and training. I have an engineering degree from the College of Engineering, Gindi, and an MBA from IIM Ahmedabad. I also have a master's program in counseling and psychotherapy, and currently I am a teacher and doing a postgraduate program in counseling and psychotherapy at the Tamil Nadu Open University. I also conduct workshops and training in psychotherapy. If you look at the question of health, it is counterintuitive to talk about physical health separately from mental health. Health represents our entire well being. Yet, how's your health and how's your mental health remain separate inquiries. It is like saying that the mind and body are separate from each other, whereas they are one. Currently, health data resides in silos, leading to costly medical errors, higher insurance premiums, and higher out of pocket expenses, as well as lost productivity. Psychosomatic disorders, which is the disorders caused due to stress, are the cause for many of the medical conditions like hypertension, heart diseases, respiratory issues, and gastrointestinal problems. They can also make serious or alter a medical condition like diabetes and cancer. Many people, studies indicate 75% across the globe have a lifestyle disorders caused primarily due to stress, and they continue to live with that for many years, and some are disabled for life. It also affects productivity and profitability, as well as bringing down the wellness and happiness quotient of the individual, the company, community, and the nation. So, as a value proposition, we plan to use a science based approach to detect and predict whether the person is psychosomatic or not. This leads to a reduction in faulty diagnosis and treating the symptoms much earlier, thereby leading to decrease in the disability adjusted life years. So, as a solution, the first step is to collect the siloed data, which is both physical and mental health, through a structured centralized database. Once we collect this data, we plan to input this data into the HAI engine, the Hygia AI engine, for analysis and prediction. So, as indicated, through a science based approach, we plan to detect and predict whether the person is psychosomatic or not. And based on that, we plan to offer the solutions for that individual. If you look at the opportunity in terms of the market size, there are three markets for us. One is the B2B space, which consists of healthcare service providers, payers, the insurance companies, as well as drug research companies, among others, wherein we plan to offer a value-based pricing program on either a recurring model or an aggregate model. Then you have the corporates, wherein we can pitch a SaaS-based, value-based pricing model based on recurring charges. And you have also a direct-to-consumer model, which could be transaction-based, primarily on mobile, which would include text, messaging, as well as video calls to healthcare experts, both the physical as well as the mental health experts. So the consultants or the health experts who would be working with the users can input the physical health parameters data into the model to understand the health of the user better, and thereby provide the correct diagnosis and prognosis. When they input this data, they will understand also through some of the analysis that they collect on the mental side of the patient whether the person is psychosomatic or not. So the algorithms can pair the patient and the disease consultant as well, plus have features for continuous monitoring and improvement. More importantly, once this initial traction is built, this model can easily be exported to any part of the globe. So it is a case of build in India for the globe. If you look at the competition, presently it exists in either the physical or the mental health domains. Currently, solution providers do not look at holistic healthcare due to the data residing in silos, as well as use science-based approach to diagnosis and care, which is what we are planning to do. In terms of the current traction, we have built a tool that captures the physical and mental health parameters, including medicine usage, doctor reports, among others, to work as a structured centralized database. We have also built inroads into corporates as well as the users to collect the data points. The support that we need is in terms of now building the AI models, as well as coming up with value based pricing schemes for the different stakeholders that I spoke about with respect to the different players in the market. Thank you so much.